Hello friends, hi, good morning, welcome to our channel The Voice of Nurse. Today's class is Community Health Nursing, the continuous topic from the previous videos. The part 1, today we are going to discuss part 1. We already finished 3 parts related to the community health nursing. In part 1, we discussed related to the community health nursing introduction, definition, community health nursing process, health assessment, epidemiology and epidemiology methods, principles of epidemiology, objectives of community health nursing and family healthcare system, healthcare team along with its introduction. Plus, we discussed related to the community health nursing, very important, and FAQs, frequently asked questions. In previous video we finished 20 questions in part 1. In part 2 we discussed related to the community health nursing from the question number 21 to 50. 30 questions we covered in part 2 video. Recently we finished part 3. In part 3 we finished 20 questions from the 51 to 70 question we finished in part 3 video. Today we are going to discuss part 4 related to the community health nursing. In this video, today's class, we are going to discuss 30 questions from the 71 to 100. 30 questions we are going to cover in this video. So before moving on to today's class, a small request friends, anybody watching first time my channel, please subscribe my channel, click on the bell icon for further notification and share your opinion in comment section, and please like a video and share the video to your friends. Move on to today's class. Question number 71. Placing people's health in people's hand is the principle of which scheme? Placing people's health is in people's hands. This is the principle of which scheme? We will see options first. Option A, urban. Option B, rural. Option C, A and B. Option D, none of the above. What is the health in the hands of people? Means the health in the hands of people brings the government closest to the people. It is necessities to a process of capacity building of communities and organization to plan, implement and evaluate health programs at their levels. Primary health care in India in 1977, the government of India launched a rural health scheme based on the principle of placing people's health in people's hand. So here option B, rural health scheme, is the correct answer. Placing people's health is in people's hands is the principle of rural health scheme in the year of 1977. The government of India launched. According to this principle, primary care and other services to meet the main health problems in community must be provided equality to all individuals irrespective of their gender, age, caste and color, urban or rural location and social classes. This is the main important principle for the placing people's health in people's hand. So here option B is the correct answer. Next we will move on to question number 72. What is one component under the umbrella of healthcare system? What is the one of the component under the umbrella of healthcare system? We will see here options. Option A, nursing. Option B, medical. Option C, surgical. Option D, all of the above. Their services would include hospitalization, nursing care, physical and occupational therapy and home health care. Provider groups also would pay for durable medical goods, acute care and subacute care, outpatient surgery and diagnostic procedure. These all things comes under the medical. So here what is the one of the component under the umbrella of healthcare system? E means here option B, medical, is the correct answer. It can be provided to the through the hospital, nursing care, physical and occupational therapy and home health care also. So here option B, medical, is the one of the component under the umbrella of healthcare system. Next we will move on to question number 73. Which is not the element of communication? In the communication process, which one is not a element from the following options? We will see here options. Option A, message. Option B, channel. Option C, sender. Option D, attention. No doubt here option D is the except here. We will see in detail about the communication process. The communication process involves understanding, sharing and meaning, and it consists of 8 essential elements: source, message, channel, receiver, feedback, environment, context and interference. These all are the 8 essential elements for the communication process. So here in this option D is the except. The element of communication process includes message, channel, sender in these options. Basically communication model consists of 5 elements of communication. It will be sender, receiver, message, channel and feedback. In basic elements also there is no attention. So here which one is not element of communication means attention is not a element of communication. Next we will move on to question number 74. Which immunization produces a permanent scar? Here which immunization, which vaccine will produce the permanent scar in our body? We will see first options. Option A, BCG. Option B, DPT. Option C, hepatitis B. Option D, measles. Most people develop a sore at the injection site. Once healed, the sore may leave a small scar. This is normal and nothing to worry about this. More serious complications such as abscesses, bone marrow inflammation and widespread TB are rare. The BCG vaccine contains live attendant Mycobacterium bovis, and following intradermal injection, the BCG vaccine elicits a local immune response. This response most often results in a ulcer that heals over weeks and leaves a flat permanent scar at the injection site. So here in these options, option A is the correct answer. Which immunization produces a permanent scar in these options means option A, BCG is the correct answer. BCG or Basil Calmette Guerin is a vaccine for tuberculosis disease. What is the BCG vaccine in India means? BCG is preferably given at the birth to provide protection in the early years when infection can often lead to diseases such as miliary tuberculosis or tubercular meningitis. Tuberculosis or tubercular meningitis. Infants may receive the vaccine soon after the birth or later, but preferably before exposure to persons with active tuberculosis. So here in these options, option A, BCG is the correct answer. Next we will move on to question number 75. What is the meaning of census report in the hospital? What is the meaning of census report in the hospital? Options we will see first. Option A, number of patients at midnight in hospital. Option B, number of employees. Option C, total number of patients in hospital. Option D, all of the above. Census report means nothing but inpatient and outpatient, admissions, death. These all things comes under the census report. Detailedly we will see now. A point in time count by a hospital of all its admitted patients and or patients currently on waiting list. These all things comes under the census report. Midnight census means a count of the number of patients or residents in a healthcare institution at the 12 am. From the midnight we have to calculate the census report. Here in these options, option A, number of patients at midnight in the hospital is the correct answer. Census report in the hospital meaning number of patients at the midnight in the hospital. Census data is the source of primary data. A census is procedure of systematically enumerating and acquiring and recording information about the members of a given population. Here option A is the correct answer. Next we will move on to question number 76. What are the oral contraceptive pills from the following? We will see here options. Option A, progestin only. Option B, estrogen and progesterone. Option C, A and B. Option D, none of the above. Here oral contraceptive pills OCP consist of the hormones progesterone and estrogen or only progesterone, and must be taken orally once per day in order to prevent pregnancy. Currently, there are three different types of available in the market. Those are combination pill, the progesterone only pill, and the continuous use. Progesterone is in a class of medication called as progestins. It works a part of hormone replacement therapy by decreasing the amount of estrogen in the uterus. It works to bring on menstruation by replacing the natural progesterone that some women are missing. So here in this option, the oral contraceptive pills from the following means, here option A and B is the correct answer. Progestin only or estrogen and progesterone. These are the oral contraceptive pills. So here option C is the correct answer. A and B is the correct answer here. Next we will move on to question number 77. Rubber catheters should be sterilized in. The rubber catheters will be sterilized when? We will see here options. Option A boiling, option B 2% glutaraldehyde, option C autoclaving, option D all of the above. Sterilizing the catheter. Rinse catheter with tap water for 30 seconds. Place catheter on paper towel to dry for 1 hour. After it is dry, place it in a container with alcohol for 5 minutes. Make sure that the entire catheter is covered with alcohol. And glutaraldehyde is used as a cold sterilant to disinfect and clean heat sensitive equipment such as dialysis instruments, surgical instruments, suction bottles, bronchoscopes, endoscopes, and ear, nose and throat instruments. Disinfection procedure for rubber tubing and catheters, glutaraldehyde based formulation. So here in these options, rubber catheter should be sterilized by 2% glutaraldehyde. So here in these options, option B is the correct answer. Next we will move on to question number 78. The vaccine for meningococcal meningitis provides immunity that lasts for about. We will see here option A 4 years, option B 6 years, option C 7 years, option D 3 years. Up to which age we can give or we can provide immunity through the meningococcal meningitis vaccine to the up to which age, means we will see in detail about meningitis vaccine. Available data suggest that protection from MHSRB vaccines decreases in many teens within 5 years of age. Getting the 16-year-old men ACWY booster dose is critical so teens have protection when they are most at risk of meningococcal disease. How long does meningitis vaccine last means administer a booster dose of Men-B vaccine 1 year after series completion and then every 2 to 3 years thereafter. For those at increased risk due to an outbreak who previously received the Men-B vaccine series, CDC recommends a booster dose if a year or more has passed since primary series completion. So here in these options, option D is the correct answer. The vaccine for meningococcal meningitis provides immunity last about 3 years. Option D is the correct answer. Next we will move on to question number 79. The numerator in prenatal mortality rate is. What is the numerator in prenatal mortality rate? We will see here options. Option A fetus and neonates. Option B live birth in a month. Option C pregnant mothers. Option D all of the above. Numerator means deaths at ages 0 to 30 days, means below the 30 days. Denominator number of surviving children yet beginning of specified age range during the 10 years prior to survey. The prenatal mortality rates are calculated as the number of infant deaths and fetal deaths divided by the number of live births and fetal deaths. Neonate means from the 0 to 28 days. between the 28 days period is called as neonatal period. So prenatal mortality rate is the sum of the number of residential fetal deaths of 28 or more weeks gestational plus the number of resident newborns dying under the 7 days of age in specified geographic area. So here the numerator in prenatal rate is fetus and neonates. So here in these options, option A, fetus and neonates is the correct answer. Next we will move on to question number 80. The word AEFI stands for. We will see here options. Option A, adverse events following immunization. Option B, adverse effects following injection. Option C, adverse effects following immunization. Option D, adverse events following immunization. And adverse event following immunization is AEFI is defined as any untoward medical occurrence following immunization which does not necessarily have a causal relation to the vaccine. The adverse event may be any unfavorable or unintended sign, abnormal laboratory findings, symptoms or disease. The other common adverse events that were reported are fever, headache, body pains, redness at injection site, swelling at the injection site, fatigue, vomiting, cough, itching, redness of eyes, shoulder pain. Most of the adverse effects were mild in nature and resolved. The common side effects of vaccines: pain, swelling, redness, mild fever, chills and feeling tired, headache, muscle and joint aches. Easily AEFI, an adverse event following immunization, is defined as medical incident that takes place after an immunization, causes concern and it is believed to be caused by immunization. So here the word AEFI stands for adverse events following immunization. So here in these options, option A is the correct answer. Next we will move on to question number 81. BMI, body mass index, is equivalent to. We will see options. Option A, height or weight. Option B, age in years or age in months. Option C, underweight or overweight. Option D, weight or height. Body mass index BMI is a person's weight in kilograms divided by the square of height in meters. BMI is an inexpensive and easy screening method for weight category. Underweight, healthy weight, overweight and obesity we can calculate through the BMI. So here weight in kgs, height in meter square. So here in this option, option D, weight divided by height. Weight or height is the correct answer here. Or BMI is person weight in kilograms or pounds we can calculate, and also divided by the squares of height in meters or in feet we can calculate through these methods. So here in this option, option D is the correct answer. Next we will move on to question number 82. Pressure ulcers in old people having partial lesions extending into the epidermis and dermis are called as. Here pressure ulcer is present in old people having partial lesions. It is extending into the epidermis and dermis. This is which stage? We will see here options. Option A, first stage. Option B, third stage. Option C, second stage. Option D, fourth stage. Here what is pressure ulcer we have to know. Pressure ulcers are an injury that breaks down the skin and underlying tissue. They are caused when an area of skin is placed under pressure. They are sometimes known as bed sores or pressure sores. So here pressure ulcers also called as bed sores or pressure sores. Here we are having stages, actually 4 stages. The stage 1, skin is intact with the presence of non-balanceable erythema is present in stage 1. In stage 2, there is a partial thickness skin loss of involving the epidermis and dermis. So here in this option, pressure ulcers in old people having partial lesions extending to the epidermis and dermis means here second stage is involved. So here in these options, option C, second stage is the correct answer. Next we will move on to question number 83. Growth or Road to Health chart was first designed by. Growth or Road to Health chart means growth chart was first designed by. We will see here options. Option A, Coral. Option B, Charles. Option C, David Morley. Option D, WHO. The growth chart was first developed by the National Center of Health Statistics NCHS in the year of 1977 to clinically analyze child development. The 1977 growth chart was subsequently used by the World Health Organization for dissemination to healthcare systems board. Growth health chart is also called as Road to Health chart. It was first designed by David Morley and was later modified by WHO. So here in this option, option C, David Morley is the correct answer. He is a British pediatrician and emeritus professor of child health care, Institution of Child Health, who saved the lives of many thousands of children in developing countries. Road to Health chart, also known as growth chart, designed by David Morley, modified by WHO. Don't confuse friends here. Growth chart first designed by David Morley, followed by designed by WHO. So here modification done by WHO. Road to Health chart is used by pediatrician and other health care professionals to follow a child growth. Actually, we are having color coded health charts. Blue chart for the boys, pink chart for the girls. These blue chart and pink chart both are only for the health charts, only growth charts. So here in these options, option C, David Morley is the correct answer. Next we will move on to question number 84. The term morbidity means. What is the meaning for the morbidity? We will see here options. Option A, incurable sickness. Option B, loss of sense. Option C, death. Option D, illness. Morbidity is another term for illness. A person can have several comorbidities simultaneously, so morbidities can range from Alzheimer's disease to cancer to traumatic brain injuries. Morbidities are not deaths. Prevalence is a measure often used to determine the level of morbidity in a population. Morbidity means also called as illness. Morbidity is a condition of suffering from disease or medical condition. For example, for the morbidity is Alzheimer's disease to cancer to traumatic brain injury. This is the best example for the morbidity. So here the term morbidity means in these options, option D, illness is the correct answer. Next we will move on to question number 85. The method of identifying the missing cases is known as. The method of identifying the missing cases is known as. We will see here options. Option A, operation. Option B, surveillance. Option C, screening. Option D, none of the above. The method of identifying missing cases is known as in the community. Screening is the correct answer. Screening in community health medicine refers as strategy used to look for unrecognized condition or raising points. People tested for screening may or may not exhibit signs and symptoms of disease. Sometimes people might present with a one symptom, but that does not give about definitive confirmation of particular disease. Screening intervention are aimed at condition could occur future some points. So here in these options, option C, screening is the correct answer. The method of identifying missing cases, screening or searching surveillance, also called as searching surveillance also. So here in this option, option C, screening is the screening surveillance or searching surveillance is called as method of identifying missing cases. So here in this option C is the correct answer. Next we will move on to question number 86. What is the contact period for chlorination? What is the contact period for the chlorination? We will see here options. Option A 90 minutes, option B 30 minutes, option C 60 minutes, option D 100 minutes. The longer the contact time, the more efficient the disinfection process is. When using chlorination for disinfection is a minimum contact time of 30 minutes is required for adequate disinfection. Water treatment steps: coagulation, flocculation, sedimentation, filtration and disinfection. In coagulation is the first step, second step is flocculation, third step is sedimentation, fourth step is filtration, fifth step is disinfection. These all are the stages of water chlorination. By the chlorination guidelines, maintain a free chlorination residue of 0.3 to 0.5 mg for after a 10 minutes contact time. This is the guidelines, according to the guidelines. But the longer the contact time, efficient disinfection process is using chlorine for disinfection. Minimum contact time of 30 minutes is required. So here in these options, the contact period for chlorination of water is option B. 30 minutes is the correct answer here. Next we will move on to question number 87. The total healthcare staff at PHC. PHC means primary health center. The total healthcare staff is at PHC. We will see here options. Option A 15, option B 10, option C 25, option D 20. As for minimum requirement, a PHC is to be managed by a medical officer supported by 14 paramedical and other staff under NRHM, National Rural Health Mission. There is a provision for 2 additional staff nurses at PHC on contract basis. Primary health center. How many people under one PHC in India means? In primary health center, 1 per 30,000 population in general areas and 1 per 20,000 population in difficult or tribal and hilly areas. So here the total healthcare staff in PHC means PHC is to be managed by medical officers supported by 14 paramedical staff. So here in these options, option A 15 is the correct answer. Total healthcare staff at PHC means 15 is the correct answer here. Next we will move on to question number 88. World Health Day celebrated on which day we are celebrating World Health Day? We will see here options. Option A 7th April, option B 8th May, option C 7th March, option D 8th June. 7th is World Health Day. 7th is World Health Day means here 7th April is there, 7th March is there. Rid of confusion. 7th April is the correct answer here. It is celebrated annually and each year draws attention to a specific health topic of concern to people all over the world. The date of 7th April marks the anniversary of the founding of World Health Organization WHO in the 1948. World Health Day is been observed since 1950. The establishment of World Health Organization in 1948. Since then, WHO organized numerous events and programs. The main aim is to promote healthy living and raising awareness about various health related issues. So here World Health Day is celebrated in the day of 7th April. So here option A is the correct answer. Next we will move on to question number 89. A process that informs, the motivates and help people to adopt and maintain healthy practices and lifestyle is called as means a process of information and motivation, help people adoption and maintain healthy practices is, and also lifestyle changes is called as. We will see here options. Option A, in service education. Option B, health education. Option C, A and B. Option D, none of the above. The process of analyzing information and motivation help people adoption and maintain healthy practices and lifestyle is called as health education. Health education analyzes information necessary in reaching out to people in the community to facilitate understanding and compliance with the being taught towards self-reliant behavior is called as health education. Why is health education is important? In the community, health education looks at the health of a community as a whole, seeking to identify health issues and trends within population and work with stakeholders to find solution to those concerns. The main purpose of health education is increase efficiency of health services, curative as well as preventive measures, improve productivity by reducing occupational diseases and accidents, to change the social climate of communities by getting the people participation in the health education. So here in this option, health education is the correct answer. Next we will move on to question number 90. The first referral level healthcare delivery institution in community. What is the first referral level of healthcare delivery institution in the community level? We will see here option. Option A, local hospital. Option B, sub-center. Option C, district hospital. Option D, PHC, primary health center. First contact between the individuals and families occurs at public health center. The first referral unit FRU has to provide 24-hour specialist care in medicine, obstetrics and gynecology, surgery and pediatrics. Hence, launch of NRHM, National Rural Health Mission in the state gives us an opportunity to strengthen referral services in the state and to cope up with the expected increases in demand of health services. So here first referral level healthcare delivery institution in community is option D, PHC, primary health center is the correct answer. Next we will move on to question number 91. For TBA, trained birth attendants. TBA means trained birth attendants. For TBA, the recommended trained period is, what is the recommended trained period for the TBA? We will see here options. Option A, 45 days. Option B, 30 days. Option C, 3 months. Option D, 6 months. Here option C, 3 is 2 months is there. There is typing error is there. So here option C, 3 months only. Here TBA, trained birth attendant, is for the training of 21 days duration is important to PHC staff nurses to improve their skills for conducting normal deliveries, identify high-risk deliveries, and early referral and care of mother and newborn baby during after the delivery. So here there is no 21 days. Approximately time duration for the TBA training period is 30 days. Exactly 21 days, but approximately here in this option B is the correct answer. 30 days is there. Timeline is suggested that institute training of a staff in all PHCs and CHCs and subsequent training of all subcenter ANMs in PHCs and CHCs should be taken up immediately into the entire task into the completed within the 6 to 8 months. It is different to the TBA and ANMs, PSCs and CSCs. So here TBA is trained period approximately 30 days, exactly 21 days. Next we will move on to question number 92. A school nurse is performing annual scoliosis screening. The nurse should assess for all signs from the following. Here, a school nurse is performing annual scoliosis screening. The nurse should assess from the following which signs she have to assess. We will see what is scoliosis first. Scoliosis is an abnormal lateral curvature of spine, abnormal lateral curvature of spine. It is most often diagnosed in childhood or early adolescence. The spine's normal curves occur the cervical, thoracic and lumbar regions into so called sagittal plane also. Scoliosis is a sideways curvature of spine. Scoliosis occurs most often during the growth spurt just before puberty. So here, children should be screened between 9 to 15 years of age. Girls have a high risk in the scoliosis. Assessment is done with the child wearing only underwear to chest, back and hips can be observed for a single C curve or two curves or S-shaped curve. So here the school nurse had to perform annual scoliosis screening, should be assessed signs, prominent shoulder blade, uneven hips, unequal rib heights. So here all of the above is the correct answer. The school nurse should be assess all of the above things. Next we will move on to question number 93. The term refers to all current cases existing at the period of time in a given population is known as. The term refers to current cases existing at the period of time given population is known as. We will see here options. Option A, incident. Option B, surveillance. Option C, prevalence. Option D, all of the above. The proportion of population who has specific characteristics given time period is called as prevalence. The number of cases of health event at the certain time. For example, in a survey, you would be asked if you are currently smoking. Period prevalence. The number of cases of health event in reference to at the time of period, often 12 months. Proportion of persons with particular disease are attributed on a particular date. So this is called as prevalence. So here the current cases existing at the period of time in given population is known as prevalence. Option C is the correct answer here. Next we will move on to question number 94. Platelet count decreases in which condition? The platelet count will be decreases in which of the condition? We will see here options. Option A, typhoid. Option B, dengue. Option C, malaria. Option D, A and B. The evidence suggests that dengue can induce bone marrow hypoplasia during the acute phase of the disease. Thrombocytopenia in dengue may arise either from decreased production of cells from the bone marrow or from increased peripheral destruction of platelets and clearance from the peripheral blood. How many days platelets fall in dengue means when do platelets decreases. In dengue fever, platelet counts usually drop significantly by day 4 of illness. In adults without dengue shock, platelet counts drop slightly to moderate from day 3 to day 7 of illness and return to normal by day 8 or day 9. Here, the platelet count is decreases in the dengue condition. Here option B is the correct answer. Next we will move on to question number 95. The commonest side effects of IUDs is IUD means intrauterine device. We will see here options. Option A, pain. Option B, bleeding. Option C, miscarriage. Option D, growth retardation. An intrauterine device IUD is a form of birth control that a healthcare provider inserts into the uterus is called as IUD, intrauterine device. Most common side effects of IUD includes irregular bleeding for the first few months with the copper IUD, heavier periods with more cramps, lighter and shorter periods with some kinds of progestin IUDs. So here the most common side effects of IUD is bleeding. Irregular bleeding is the correct answer here. Option B, bleeding is the correct answer. Other side effects for the IUD is spotting between periods, irregular periods, heavier or longer periods, more or worse cramping during the periods, pain when IUD is put in, cramping, backache for few days of the after insertion. So here the commonest side effects of IUD is irregular bleeding. Option B is the correct answer. Next we will move on to question number 96. In India, rabies free zone is. In India, rabies free zone. We will see here option A, Goa, option B, Lakshadweep, option C, Sikkim, option D, all of the above. In India, the rabies free zone is Lakshadweep. Not only Lakshadweep, first place in Goa, second one is Lakshadweep, third one is Sikkim. Detailedly, Goa, Andaman Nicobar and Lakshadweep, Sikkim and Nagaland. These all are the rabies free zones in India. Write down friends or note it once. Rabies free zone in India means Goa, Andaman Nicobar and Lakshadweep, Sikkim and Nagaland. These all are the free zones for the rabies. So here option D, all of the above is the correct answer. These all are the free zones for the rabies in India. Next we will move on to question number 97. Most common symptom of hyperthyroidism. The most common symptom of hyperthyroidism. We will see here options. Option A, dry bottle hair. Option B, diaphoresis. Option C, menorrhagia. Option D, blindness. The hyperthyroidism tends to cause sweating over the entire body, including the face, neck, armpits and palms. Night sweats are also common symptom of the hyperthyroidism. This is made due to the poor temperature regulation and abilities of these individuals. Here, excessive sweating is also called as diaphoresis. Diaphoresis means excessive sweating due to a secondary condition. It may be medical condition, life event or side effects of a medications. Common causes includes menopause, hyperthyroidism and various medications. Treatment will vary depending on the cause of condition. So here most common symptom of hyperthyroidism means diaphoresis. Excessive sweating is the correct answer here. Diaphoresis means excessive sweating. So here option B is the correct answer. Next we will move on to question number 98. The main focus of primordial level of prevention is. What is the main focus of primordial level prevention? Primordial level of prevention. We will see here options. Option A, early treatment. Option B, early diagnosis. Option C, lifestyle modification. Option D, health education. The main focus of primordial prevention is prevention level before primary prevention, that includes modification of lifestyle, adopting healthy lifestyles to prevent the future problems. Before it itself, we have to prevent some of the symptoms. For example, here lifestyle modification. The main focus of primordial level of prevention is lifestyle modification. In detail, I will explain. Primordial prevention is the earliest prevention modality to aim at children to decreases as much risk exposure as possible. Primordial prevention targets underlying stages of natural diseases by targeting the underlying social condition and promote diseases onset. So here the main focus of primordial level of prevention is option C. Lifestyle modification is the correct answer here. Next we will move on to question number 99. Ecology is branch of science that includes. Ecology is a branch of science that includes, we will see here options. Option A, relationship of human beings. Option B, study of environment. Option C, relationship of living organism and environment. Option D, study of science. Here ecology. Ecology is a branch of science including human science, population, community, ecosystem, and biospheres. Ecology is the study of organisms, the environment, and how the organisms interact with each other and their environment. So, here ecology means is a study of living things interact with each other their environment. So relationship between the living organisms and environment. Ecology is the branch of science that includes relationship living organism and environment. So here in this options relationship of living organism and environment. So here option C is the correct answer here. Next we will move on to question number 100. This is the last question in the part of community health nursing. Exotic disease means. What is the meaning of exotic disease? We will see here options first. Option A, infection in the body. Option B, transmitted through respiratory route. Option C, imported from outside of the country. Option D, presence in bloodstream itself. Word exotic disease, in the name itself is a exotic means outside. Exotic disease or exotic infection should strictly mean infection from another country or that which is at least strange or bizarre, but is most frequently used among dermatologists to mean infection that is rare. Exotic disease is an infectious disease that normally do not occur in the region. Exotic disease, for example, for the exotic viral diseases, African swine flu or African swine fever, blue eye disease, classical swine fever, foot and mouth diseases, Japanese bee encephalitis. These all are the conditions, for example, for the exotic viral diseases. What are the exotic diseases is present in the India? India and South Asia have about half of the world's cases of Kala Ajar, lymphatic filariasis and leprosy. These all are the commonest exotic diseases in India. Exotic disease means imported from the outside country. So here in these options, option C is the correct answer. This is the last question in this part 4 related to the community health nursing. Till now we finished community health nursing 100 questions. Almost we already finished almost subject related to the MHSRB syllabus. Next subject we are going to discuss related to the sociology. Sociology point of view, we will discuss very important and FAQs related to the previous year questions. Thank you so much for watching my channel, and thank you so much for watching my video. And anybody watching first time my channel, please subscribe my channel, click on the bell icon for further notification, and please give a like and share your opinion in the comment section. Share the video to your friends. Stay tuned friends, keep watching.